All right, welcome to Clinical AI Academy, the Clinical AI Rounds. This is the second episode of the Clinical AI Rounds, and we are going to discuss why external validation matter. So we have the clinical case. A colleague sends you a paper claiming 95% accuracy for an AI tool that detects acute stroke on CT scans of the brain. This sounds impressive, but you wonder, would it perform the same way on our own scanners in the hospital with our own patient population? So, as you might know, most published models are tested on the same kind of data they were trained on. So, the same scanner, same center, same patient mix. So, what you do when you're testing a model, you have, for example, let's say a dataset that is public, and you take this dataset. So this dataset is made of, let's say, 20,000 images. You take usually from it like a portion for training, portion for validation, and a portion for testing. But this is all considered internal validation. So even the validation and the testing coming from the same distribution, same patient population, same scanner, and the same center, sometimes multi-center, but you know what I mean. So the idea is you have a data set, but you validated your model on that data set only. This is great, this is useful, but then this model does not tell us how it performs in the real world. So when the same algorithm is tested on data from another hospital, let's say that it has never seen, with different imaging protocols, different population characteristics, usually the performance drops. And this is the external validation. And actually, this is the most important step before clinical use. So, for example, radiology AI model that claims over 90% accuracy in one data set sometimes fall to 70% or less when evaluated externally. And the drop isn't because the model got worse. It's because the environment changed. And that's why a model that performs perfectly in research, in a research paper, may not reproduce those results in your own clinical setting. So this is very important to keep in mind when evaluating or when you're trying to use an AI model in your clinic. So the takeaway from this today's clinical AI round is a clinically safe model isn't one that's accurate somewhere, but it is actually the one that is accurate and reliable everywhere it's used, and particularly where you're using it yourself on your own patient's population in your own clinical setup. So that's important to keep in mind. So when reading an AI study or evaluating a product, check whether it's been externally validated, and ideally validated on your own dataset or on data resembling your own. So if the performance data come only from the development side, it's treated as preliminary and not clinically proven. I always ask, has this been tested on different institutions, not only on this dataset? And if the developer report site-specific results, so you could compare, maybe there you have an institution that resembles your institution, like infrastructure or data population. So you ask, okay, how did it function for them? Well, did the performance drop or not? If it did, it probably will drop also in your institution. So that was today's clinical AI round, and please feel free to tell me what you think, join the discussion, share your ideas, and see you in the next one.